Good morning. First of all, I'd like to thank you for accepting the invitation to participate in this meeting, and I would like to thank the pharmaceutical company because it has made an effort to organize this presentation, which is a parallel presentation to the conference. It couldn't be included in the conference for reasons outside our control. And I've come here today to answer the following question. Is there an unmet need in the management of HPV patients? And I believe that most of you consider that there is an unmet need in the management of these patients. My presentation will be brief because the longer presentation with all the details will be given by our colleague, Javier Cortés. I will speak briefly about the natural history of the HPV. You know how the virus reaches the genital tract. This doesn't mean that it will cause a problem, but it can cause an infection and lesions and even cervical cancer. However, what happens with the natural history of HPV infection is that we always focus on the top of the pyramid on the cervical cancer cases and the high-risk HPV cases. And we forget about the base of this pyramid because we know that 8% of the population, and you only see women on this image, but this is also applicable to men. Both men and women, 8% of the population will be in contact with this HPV, and we know that 80% of them will be able to eliminate it spontaneously, but not all patients will eliminate it spontaneously. And we know that 40% of low-grade lesions do not have a spontaneous regression after 2 years of HPV infection. So I'd like to focus on low-grade lesions. This is a study by Matsumoto in Japanese women between 18 and 54 years of age. This is the regression rate at 2 years. We have the total number of HPVs, we have the high-risk HPVs, and then what I call the bad guys in HPV. We see, therefore, that 40% of L-cells with high-risk HPV don't have this regression. There's a persistence of HPV at 2 years. And now let's look at the progression rate. We know how many patients show progression, and almost 13% of high-risk HPV patients progress, and in this group of the bad guys, up to 17% can cause cervical cancer at 5 years. If we look at the HPV clearance, this is another study with 374 women with ages between 29 and 59 and low-grade lesions. At 6 months, the likelihood of clearance in high-risk HPV is 29%, but in the case of HPV 16, it's only 9%. And at 18 months, the clearance rate is higher in high-risk HPV, it's 41%, but in HPV 16, there is still a very low clearance rate, it's only 19%. And this means that in patients where there is a persistence of HPV, at 6 months it's 71%, at 18 months it's 59%, and in HPV 16 patients, the persistence is 91% at 6 months and 81% at 18 months. What happens when we have the progression of an L cell? It can progress to an H cell. Then we would need some resection, a conization, but this progression can even lead to cervical cancer. And this is what we have to try and avoid. We know that 20% of women with persistent HPV at 1 year may develop intraepithelial lesions or cervical cancer at 5 years. Why do we try and avoid conizations? Why we want patients to go from L-seal to H-seal? Well, because conizations cause the loss of cervical glands and the destruction of the cervical stroma. This means that there's a higher risk of infections and also cervical scars. And this means that there's a higher likelihood, due to the patient's structure and condition, there's a higher risk of inflammatory pelvic diseases and cervical stenosis. And this means for childbearing women, obstetric problems, and the risk increases depending on the type of technique, the size and number of conizations, because there is quite a large number of patients who need a reconization. With regard to the consequences, if a woman has had a conization, there's a higher risk of early delivery, and therefore during the childbearing years we have to try and minimize the extirpated area. So we mentioned before that there's an unmet need because the bottom part of the pyramid only has control visits, checkups, and follow-up as the standard treatment path. Now we have a treatment, as Dr. Cortés will explain. Papillocare gel, vaginal gel, will help eliminate the virus and the lesion. And that's all. Thank you very much for your attention.